Order for enemas till clear, and so that just means that we want to give him enough enemas to where what's coming back is see-through, basically. And sometimes that'll be 2 or 3 passes, okay? We want to get a way of escape, which means, where he's going to go to the bathroom. Now, if he was constipated and his colon was full, then I would say we want to use the bedpan for the first pass, because they don't have the musculature, if you've got stool in there, to close things off, and they're going to poop all over your shoe and your floor. So, but if it's for a colonoscopy and they haven't been constipated, then there should be enough musculature, not so much stool in there, where they can clamp down and maybe, depending on his ability to walk. With his chest tube and his trach and all he probably isn't going to walk very well, so we're going to just put him on a bedpan, okay? So I'm going to get the large volume enema ready. Let's talk about the small volume just a moment. It's all the same thing, except for just a little tiny bottle. We're going to take the cap off, stick it into the flange, and then we're going to squeeze and the fluid will be in. For large volume, we want to get the fluid ahead of time. We can do tap water with oil. We can do all sorts of different things depending on the order. We want to go ahead and prime the bag and get it to the end because we don't want to give them any air, okay? And we also want to make sure that this is a warmer. If you give them cold fluid, it's going to cause a lot of cramping. So we want to have discussed all of that with him ahead of time. Let him know why we're doing the enema. We're going to turn him on our left side because that's where the rectum and the descending colon is. It's on our left. Okay, so we want to make sure that the end is lubricated. I would say, maybe 2 inches or so. You don't want to get too much on there because it's very difficult to push a tube in if you've got lubricant all over your hands. Okay, now we want to check for hemorrhoids, any rectal tears, or any kind of ask them if they're having any pain before we get started. Okay, we want to pad our bed with a disposable chuck, and we also want to have wipes available. Okay, so now we're going to go ahead and put this tube in, and we're going to advance it. Boy. Okay, well, we'll just call that good. I have no other comments at this moment. Okay, so I'm going to open up the fluids, and I'm going to let them run in. We're going to let them go, I'm going to be watching the amount on the bag. We can maybe put 250 in or so. And then as he says, okay, I've had enough, we always tell him, you have the power here, you can tell me when to stop. A lot of times I'll just stop, leave the tube in place. Okay, nothing's flowing in, just kind of breathe through the cramping because you will get cramping. Breathe through it, breathe through, breathe through. Okay, so when they're done with that, then I want to get the bedpan ready. This is not a bedpan, but you get the gist. Okay, I want to get them ready to be put on it. I'm going to take the tube out. I'm going to cover it with a paper towel and set it near the trash can. I don't have any place else to put that, but I want to cover it. And then I'm going to put them on the bedpan. I'm going to turn them back on their side, or on their back rather, get them comfortable on the bedpan. Okay, put the head of their bed up. Put the head of their bed up, and then give them some privacy. Put the bed all the way down, closest to the floor. Am I going to hit that chest tube? Okay. Okay, bed's all the way down. Head's all the way up. And then tell them to put their coat light on. We'll help them get off the bedpan because we want to see the return. Okay. Same if they've walked into the bathroom, we want to use a backwards hat, if you know what I mean, and we want to see what's coming back out. We also like to measure it because what goes in should come back out, right? With the additional material. Then we want to document how the patient tolerated it, how many passes we had to do, how much fluid we put in, what their stool looks like, and if the last time we did a pass, everything that came back was clear. Then we want to get our patient in the most comfortable position, ask them if there's anything else they need, fix the pillowcase because it wasn't put on appropriately in the first place. All right, that's it.